CVA, a cerebral vascular accident or a stroke. These three letters do not mean much for most people. And yet, according to the WHO, CVAs are responsible for over 17 billion deaths a year worldwide. 1 death out of 3. By 2020, projections expect them to be the first cause of death and disability on our planet. But having a stroke does not necessarily mean dying. 60% of stroke victims survive their CVAs. Marcel EBONGUE is one of them. 3 years ago, he suddenly collapsed and woke up paralyzed on the left side of his body. He's since had to learn to live with this disability and to relearn simple gestures.
I felt a shock. I almost fell over. My daughter, who was there, wondered what was wrong with me. At one point, I stood back up and told her I wasn't feeling well. And I felt a shock, as if I had been split in two, as if, sorry about the way I'm going to explain it, but as if, like when you split wood in two, it felt exactly like that. My whole left side lost its mobility. By the time my wife got there, she couldn't recognize me anymore. I had changed too much. My mouth was all twisted, and I had lost mobility in my left side. So they helped me, they put me into a car and drove me to the hospital.
The General Hospital of Douala. Every day, stroke victims are brought here. For some of them, it's already too late. But for the survivors, it becomes a race against the clock. The faster the patient is taken care of, the lesser the after effects will be. Dr. Salomon Mbahe, a neurologist, is a CVA specialist.
What is a cerebral vascular accident? It's the brutal occurrence of a neurological deficiency, and we think it's vascular. You have to know that vessels supply your brain with blood, and each vessel supplies a particular area of the brain. Each vessel has a specific function, and each time there is an accident in an area, you lose that function.
The left side is still deficient. I have still not recovered mobility. It's true. But still, these days I'm doing much better. People don't have to carry me anymore. I use a cane, and sometimes in my living room I manage from one chair to the next without the cane.
This is motility, what allows us to move. Motility is here. So if an accident happens in this area, part of your body will be paralyzed. But if it happens in this area, here, the blue one, you will have sensory troubles. This is the center for all sensitivities, so you'll get sensory troubles like pins and needles in your hands, heat waves, or great pain. And if the occipital lobe is hit, your sight will be affected. The temporal lobe here affects memory, and here is the ear. This is your hearing. So if it is hit, you will have hearing and memory loss. You can often see people who've had strokes and who don't speak. They have aphasia. That happens around here. There is an area for spoken language and an area for written language. When this whole area is hit, you can't speak or write well anymore. It's called aphasia. Obviously, nobody can tell you how much of the lost function you're going to recover. 1%, 2%, 10%, 50%. Nobody can tell. It's up to nature.
In Cameroon, 1 adult out of 4 suffers from high blood pressure, a pathology which makes them more susceptible to strokes. And yet barely 5% of these people are treated. A stroke is always brutal and unexpected, but its causes are well documented.
There are 2 kinds of causes for CVAs. The unalterable risk factors for CVAs. It's hereditary. It's the fact that you're a man instead of a woman. It's that you're over 50 years old for a man, 60 for a woman. That your mother or father had a stroke when they were young. All of that means that you are more likely to have a cardiovascular disease, and unfortunately there's nothing you can do about it. And then there are the risk factors you can do something about. Alterable risk factors for CVAs. At the top of the list is high blood pressure. There's also tobacco, an important cardiovascular risk factor, cholesterol, inactivity, diabetes. All these elements put together magnify the cardiovascular risk and the risk of having a CVA.
Before his stroke, Marcel led an ordinary life. He did not smoke or drink, but he was faced with the death of two of his loved ones a month apart.
I'll be honest, I was feeling a little run down, but I didn't think of checking my tension, just in case. Maybe the doctors would have told me to be careful. I don't know. But I felt run down for a while. I thought about the flu and other common diseases.
The other consequence of a stroke is social. In most cases, the patient cannot go back to their job. The treatment costs a lot, and many families end up penniless. A stroke marks the beginning of a fight against disability, since you have to live on, progress, and recover some of your skills a little more each day.
Walk over there now. Go ahead. The right side is paralyzed. Look at the position of the hand. And the paralyzed foot. Look, he can only move it a little. The left foot is well above the floor, whereas the right foot brushes it.
Mr. Nkake is a young 44-year-old patient. He's been with us for 8 days, since he's had a stroke, a hemorrhagic stroke in his case. He's a very young patient. He didn't know he had high blood pressure, but now we know that he does have it. He hadn't been diagnosed or treated for it. This patient was living a very normal life. He was getting ready for work, and then suddenly he got a cephalalgia, a splitting headache, coupled with a hemiparesis. One side of his body went weak, and he couldn't walk anymore. Strokes can manifest in such different ways, but each patient with a neurological deficiency, like paresis or a blind eye, or intense cephalalgias, must come to the hospital straight away. After a stroke, it's always possible to recover, to get your life back, like Mr. Kake, who can walk again now, and who's not done with physical therapy.
Can it be cured? A cerebral vascular accident is a consequence, the consequence of a deficiency. But here at the General Hospital, we are setting up a structure for neurocardiovascular intensive care. And this will allow us to provide these patients with treatments to cure them. If you have a stroke like an ischemia and you get to the hospital within 3 hours, then we can give you a drug that will erase the obstacle and fix your deficiency. We're talking about a cure. But if it takes you more than 3 hours, there will be after effects, and they can be tough.
Marcel never gave up, and he never thought that he would climb stairs again.
When you have a stroke, you need a lot of willpower. You can do physical therapy and give yourself the best chance of recovery. The man in the film, you can see him walking. And thanks to his physical therapy, he will eventually be just fine. We have good physical therapists here in Douala. And I think this kind of problem is treated very seriously by our doctors.
Physically, I feel fine. I am fine. They even tell me that I look better, that I look healthy. I hope so. They can see me, so they tell me. I think it's a good thing.
Having a good hygiene, getting checked by a doctor. Strokes never warn you they're coming, but you can warn them away. It will be a global health issue in the upcoming years.